today on the Frontline Health podcast.
About it. Most kids who suffer from ADHD are told you're different, you can't do something, or they struggle with something and maybe they can't sit still and they're told by their teacher, hey, just sit in your seat, stop. And all they're getting is kind of that negative reinforcement. So I think that has a lot to do with some of the mental anguish that somebody with ADHD has, along with the fact that you've got so many more hormones going through that young person's body. It really creates a lot of confusion. And then when you throw on some of the medications that they're on, it can be a very, very disastrous combination of things that can send them spiraling on the anxiety side, on the depression side.
Welcome back to the Frontline Health podcast by Centurion, where we explore the latest in health and wellness. I'm your host, Evan Patrick. With me is founder and CEO of Centurion, Troy Duell. Today, we're going to be talking about ADHD in honor of National ADHD Awareness Month. And specifically, we're going to talk about how exercise can be a way to kind of manage and treat some of the symptoms of ADHD. Troy, this is a huge issue going on today. ADHD is rampant among our kids. As a teacher, I've personally seen how this makes it difficult for kids to be able to learn. So I'm wondering, Troy, how does exercise and just staying active actually play into a kid's ability to manage their impulses and the other issues brought on by ADHD?
It's a great question, and I think most of us realize that this generation and the kids today really aren't as active as they were up to 10 years ago.
That's right.
They've become less and less active as time has gone on. And there are plenty of studies out there that show ADHD and the symptoms of ADHD are actually improved every time you get out and you do some exercise. In particular, they found that focus, reducing impulsiveness, and even helping with anxiety and depression, all those things are benefited from getting the right amount of exercise each week.
Yeah, and it's really interesting how they have trouble managing their impulses when they're not active. It's almost like their body is kind of telling them that they need to get up and move.
That's right, which is something that I'm sure you saw in the classroom when you were teaching a lot, because kids, and the classroom's probably not built for boys anyway, because boys are naturally much more active, but it makes it even more difficult when they're sitting there all day and then they get home and then they're probably playing video games or something else. And
that's exactly
less exercise.
Doing things that actually make their attention worse.
Yeah, absolutely. And I think understanding that when you exercise, it actually affects the brain chemistry. You release dopamine, which is the good chemical that kind of gives you a calming sensation over time. So it elevates your mood. So that's the reduction of depression and anxiety that goes along with it. So those are certainly things that you want to look at, make sure that people are getting plenty of exercise.
It's interesting. So I have heard some people in the medical community that I have talked to, some are proponents of kind of prescribing exercise as something for their patients to do, like as a form of treatment. But then I've heard some who are very against that, and the reason that they give is sort of, if you prescribe exercise, people won't do it because it's a difficult thing to do, right? And so kind of sounds a little bit defeatist to me, that you can't change people's minds to get them to engage in something that's going to be good for them, but requires a little bit of extra work. So do you think it's possible that exercise can work like medication? What are kind of the challenges to that?
Yeah, there was actually a study in 2020 that showed regular exercise did improve cognitive and behavioral functioning in kids with ADHD. So it's super important not just to hear those things, and I hear what you're saying, and I hear what a lot of other people are saying, which is, well, they're not going to exercise anyway, so why tell them to do it? And I think that loses the point. We have kids that we raise and we potty train, even though it didn't seem like they would ever get potty trained. We had to tell them that that wasn't what you needed to do in order to get them there. And it may take a little bit of time, but eventually I think you'll get there and people will start to learn and grow in that. But we can't start dumbing things down based on what people want to do. We need to start really educating them on what they should do instead of what they want to do.
That's right. That's what we're all about here, taking ownership of your health.
That's right.
So I also read that during the pandemic, physical activity in kids dropped dramatically.
Hmm.
So I think it's safe to say we are not out of many of the issues that kids experienced during the pandemic that were specific to them. So how did COVID-19 affect kids with ADHD in particular, and as it relates to this idea of lack of activity?
Yeah, it was absolutely devastating if you begin to think about it. Only 24% of kids prior to COVID were actually getting enough exercise a week. Only 24% were getting at least 60 minutes a day of exercise, which is what they recommend. And once COVID came around, all sports were stopped, or most sports were stopped. It took a while for it to get back, so practices were canceled,
Mm-hmm.
other things happened. So you didn't have that same level of activity going on that you would hope to see, especially in young people, an opportunity for them to get out and exercise. And we've all been young. We need that discipline. We need somebody else sometimes to push us along and encourage us to get out and exercise. And when COVID came around, it certainly stopped most of that, because whether it was out of a overly cautious mindset of let's don't practice because we don't want anybody to get sick,
Mm-hmm.
but it really kind of went against what we knew as some of the norms for years, which is kids need to get out and we need to be outside. That's how we stay healthy, and exercise certainly is a part of that.
That's right. And I think about just all the different things that being outside does for a kid. I mean, all kind of variety of what parts of their health that are improved by that. Being in the sun, they're exposed to vitamin D. Being
That's
around
right.
with friends playing, they're getting that social engagement that they need and that we're also seeing difficulties with. So, aside from medication-like effects, what else do you think that exercise does for kids with ADHD?
Yeah, well, we already talked about the one study in 2020. There was another study in 2019 that actually it was a compilation of about 14 different studies, and they compiled all that info and they saw that it definitely improved anxiety levels.
Hmm.
It improved depression levels, so it made people less depressed. It didn't make them more depressed, and it reduced their aggressive behavior, which some of that stuff just makes common sense to us,
Yeah,
because if if you have a boy or somebody who's highly agitated during class, they need some of that physical exertion to
that's right.
get that out of their system. So then that just kind of calms them down over time. And the beauty of that was they did studies based on kids who were playing basketball or soccer or any type of physical activity. It didn't really matter. It could even be just somebody walking to help get those endorphins rolling in your body, because we know they're so beneficial for you.
That's right. I know I personally feel better on days when I exercise in the morning. You get that endorphin release and you get that
Absolutely.
energy out and you feel so much better. And strangely, you feel more energized throughout the day
Yeah.
as well, and not just for the time being. So um, that's good advice for everybody.
Absolutely.
So we touched a little bit on the social aspect of this exercise and specifically the type of ways that kids are active. We know that sometimes the social side of things is an area where kids with ADHD kind of struggle. A lot of times because they can't control their impulses or struggle to control their
Mhm.
impulses, and so some of those things make it difficult for them socially. How can exercise help with that specifically too?
Well, exercise obviously is important. We've already touched on that. But the fact that when you're exercising, especially in team sports
Right.
and even in individual sports, when you go to a practice, you're usually in a group of more than one person when you practice. It's rare that you can practice by yourself with something.
Mm-hmm.
So when you get into that group, it's only going to help increase that opportunity to get to know somebody. It takes you out of that social isolation, which we know a lot of kids with ADHD certainly suffer from that, and that increases their likelihood of being depressed,
Mm-hmm.
being anxious, because they feel like they're totally different. But anytime we can get them around other kids in an activity where they can really see themselves stretched, I think it's super beneficial and can only add to their mental health as well as physical health.
It's very interesting. So exercise doesn't just burn off this excess energy that they have. It actually helps kids as they develop social skills and emotional resilience too.
Absolutely. That is something incredibly positive for them. It gives them just kind of that extra emotional energy that they need to
Mm-hmm.
get through the day. They don't feel quite as socially awkward when they're a part of a team,
That's right.
and they can get some of those things really working in their favor. That we all know that age and stage of life is can be an awkward age and stage of life. So, and they're always looking for an outlet. So,
Yeah, and that's interesting. So, as a tennis player and former tennis coach, I've certainly seen kids get some emotions out on the tennis court and on the athletic field. So that's interesting. Sometimes in the wrong way, but
that's right.
for the most part, it allows them to get that out in the right way. So that's good. All right, so let's talk a little bit about mental health because I know ADHD, it often comes with other challenges like depression. And we know that's another huge issue that our kids are dealing with right now. And not just kids, but young adults too. It's really interesting because, relatively speaking, we live in one of the most prosperous societies that there has ever been.
Yeah.
Physically, and of course, this is a generalization, we're extremely blessed. We have so many things going for us and so many conveniences, things that we take for granted. Life should, on paper, be a lot easier for people now.
True.
But we're seeing new challenges in the area of mental health and even an increase.
Yeah, and I think some of that, especially with ADHD, if you think about it, most kids who suffer from ADHD are told you're different, you can't do something, or they struggle with something and maybe they can't sit still and they're told by their teacher, hey, just sit in your seat, stop. And all they're getting is kind of that negative reinforcement. So I think that has a lot to do with some of the mental anguish that somebody with ADHD has, along with the fact that you've got so many more hormones going through that young person's body. It really creates a lot of confusion. And then when you throw on some of the medications that they're on, it can be a very, very disastrous combination of things that can send them spiraling on the anxiety side, on the depression side. So that whole idea of, are there ways that we can reduce the amount of medication that they're on to help them cope with this depression, with this anxiety, and really come alongside them to push them. And to your point earlier, you talked about how we're living in one of the most prosperous societies.
Yeah.
There's not a lot of struggle. There's not a lot of failure that goes on in our society. And in many ways, we've made it so easy that they don't have to strain. They don't have to strive for things. And when we do see just a little bit of straining and striving, we think it's different from somebody else.
Right.
We think that that's not supposed to be a part of our upbringing in life. But truly, that's what makes us who we are. And there are plenty of studies, which I think is interesting, where they see ADHD as a true benefit for a lot of different people. ADHD, from the standpoint of people within the military, they have found a huge benefit because they can see things much faster. They react faster. They're willing to go towards things that most people may be fearful of. They take higher risk, and a lot of our entrepreneurs are
I was going to say, I've heard the same thing about CEOs. Is that true for you?
Probably. Yep, definitely.
That's interesting how you can actually see it as something that can work in your advantage when you use the right channels and you do the right things to take care of your body. So this is interesting because this brings up kind of, as we're talking about exercise as a way to manage ADHD, can you talk just a little bit about the types of medications that are being prescribed today? They're stimulants, actually. And that can be really confusing for people because you're talking about taking a kid who already is overstimulated. They're receiving so much stimuli that their brains have trouble processing it and controlling themselves when they're dealing with it. So why do doctors prescribe stimulants for ADHD? And how does that help kids, but how is that also harmful for them?
Well, obviously, you're putting a stimulant into your body that we know long-term has some disastrous effects. We know that amphetamines, especially when they use it illegally, we've seen the heart muscles really get expanded, the blood vessels get expanded, so it can cause some serious complications down the road from studies that we've seen. From the good side, we know that in some kids, especially kids with ADHD, it seems to have the total reverse effect that you would think, because to your point, these kids are already overstimulated, and we're giving them a medication that is going to stimulate even more what's going on. But I think we've all heard those commercials on TV where it talks about, hey, this side effects could include sleepiness.
Right.
But then on the flip side, it says side effects could include being unable to go to sleep. So every medication that we have and that we take is going to either speed up or slow down what your body is already doing. And that's what it does for these kids who have ADHD. They found a link that in your brain that it will actually slow things down even though it's already sped up to a certain level.
That's very interesting.
Yeah, it's kind of cool.
It is. So we've talked a lot about exercise and how that can help kids with ADHD to kind of manage some of the symptoms of ADHD. So is there a specific type of exercise that actually is best for kids with ADHD? I know you mentioned team sports from a social perspective, but does it really matter as long as they're getting outside and getting active?
Most of the studies don't say one sport over another or one activity over another. Really what they talk about is you need to get outside, you need to be doing something that is physical, whether it's outside or inside, working, lifting weights or walking on a treadmill. It doesn't really matter as long as you're getting 60 minutes a day of your body actually doing something physical. They have found that that has been the key to really reducing those ADHD symptoms and getting some benefit out of it.
So that's good news for me. Yes, playing team sports earlier on in my childhood, but being a tennis player, people can sometimes perceive tennis players as a little bit selfish and into themselves. So that's good news for me to know that that still has the same benefit.
Yes. So it doesn't matter what it is, just get out and do something for sure.
Great.
Yep. Don't make it complicated.
That's right. So before we wrap up, what is the takeaway for parents who are listening today who maybe are struggling with a kid? They might be at their wits' end. They've dealt with their kids' ADHD. They've tried everything. They've tried the medications. They just don't know what to do with their kid. They might be hearing about behavioral issues going on at school, and they're just really struggling with what to do with their hyperactive kid who has ADHD.
Yeah, I think probably the biggest takeaway is understanding that exercise is never a bad thing as long as you don't exercise 24 hours a day. Exercise always brings benefit. And if you can get your kid out there for 30 to 60 minutes a day just exercising, it's going to have a great return on their ADHD symptoms. And I think if you're old enough and you remember PE class or going to school, some of the punishments they used to have was if you acted up in class or you were kind of anxious in your seat and disturbing class, they'd have you run 10, 20, 30 laps in order to get that out of your system.
Yes.
I know I was the subject of several of those, and it worked. It helped reduce that anxiety. Either it helped because you were like, I don't want to do that again, or it helped because it made your body tired enough that you could actually pay attention after that.
Well, that's great. So not only does this help with ADHD, but it also sets kids up for just a lifetime of healthy habits, which I'm sure is what all parents want for their children.
Absolutely.
Well, thanks for breaking that down, Troy. That's all we have time for today, but this has been a really insightful and enlightening conversation. If you're a parent or a caregiver of a child with ADHD, definitely consider making physical activity something that you incorporate into your child's and even your daily routine.
That's right. Thanks for tuning in, and remember, go out today and take ownership of your health because nobody else cares about your health more than you do. And super excited about you being here, and hope you take care and stay healthy until next time.
If you enjoyed what we had to say today, be sure that you like and subscribe to this podcast, as well as to our social media outlets, Facebook, Instagram, Twitter, X, YouTube, and everything else. So we'd love to have you continue to be a part of our family.